CIRSE 2012 will feature a session specifically focused on women in IR. When this initiative started in 2017, the session aimed to explore the barrier to women choosing a career in IR and to identify ways to attract women and ensure the continued growth of our specialty. Consistent with this aim, the ETF has chosen to interview a woman who can be a model for those who want to follow a career in IR. It is a great honor for me to interview Dr. Irene Bargellini. Irene has distinguished herself especially in interventional oncology with a specific focus on liver local regional intra-arterial therapies. Due to such recognized skill and experience, she has been a member of Standard of Practice Committee of CIRSE. She published over 70 papers in the field of interventional vascular radiology, interventional oncology, and liver imaging. So, welcome, Irene. The first question is about your motivation. Why, at the very beginning of your career, are you interested in interventional radiology?
Well, first of all, thank you for inviting me. And to answer to your question, it was really, I would say, love at first sight. When at the very end of the medical school, we were supposed to do an internship in different clinical departments. And at that time, I was interested to either oncology or surgery. And well, when I entered radiology, and the very first day I was in the angel suit, and during that week, I was able in the angel suit to see so many different procedures. I saw ablations and revascularizations and chemoembolizations. And well, right away, I realized that that kind of specialty would enable me to join all together all the different things I was interested in. So imaging, oncology, and surgery. And I realized that that was my true passion.
The interventional radiology department in Pisa, when you grow up, is a peculiar reality. In fact, the number of IR women exceeds the men's one, 8 versus 5. How did it happen?
Well, actually, it was not that way a few years ago. When I started, I was actually the only woman in the group, and it was quite hard to get accepted by my men's colleague. Then I had to show that I really wanted to do interventional radiology. I didn't care about X-rays and so on. I was available 7 days a week and 24 hours a day. And well, over the years, I started really doing the same work as the men did. And I think that over the years, more women joined us because I would like to think that they also saw my experience and realized that this kind of work was absolutely available also for women. So I think I was an example for them too. And today we have many young and very enthusiastic professionals that are very collaborative, and it's a very nice work.
What are the main strengths and the limitation of such predominantly female group?
Well, I think that my personal belief is that women can be much more collaborative and they're much more organized. You know, that women by themselves, they are intrinsically multitasking. So they can do many different things at one time. And that's certainly a strength of having a good group of women together. At the same time, we know that women are moody, much more than men. Sometimes they are too much sensitive, so some misunderstanding may happen. And you need to take care of having a good group with good communication and avoid competition. And I think being balanced between men and women is a good choice.
But avoiding being toward motherhood turns a stop in IR activity, not only due to the X-ray exposure, which can be overcome by radio protection, but also due to the biological risks. So how did you invest your time in your pregnancy period?
Well, basically in the months of pregnancy and also for 1 year after my child was born, I mostly did diagnostic radiology. and invest all the rest of my time collecting database and doing meetings with clinicians and taking care of research in IR. So I never really felt being left out from interventional radiology during that time. And it was not hard to go back to work after that period.
In your personal experience, was it difficult to balance your family and professional life?
Well, I cannot say no. It is difficult sometimes, but it's difficult for, I think, for every woman that works hard like we do. Undoubtedly, it's very important to have a lot of support from your family. I'm a single mother, and so when I'm abroad for work or when I'm on call during the nights, I have a lot of help from my mother. Without her, I couldn't do this work. But you know, at the same time, I think that the time you invest in your work also means being have some satisfaction from what you do, and that I believe makes you also a better parent and a better mother.
Over the years, you have increasingly focused on interventional oncology, becoming one of the main representatives in this field. How did you make yourself known in the international community?
Well, I don't know if I'm so much well known in interventional oncology,
You are.
but you know, certainly knowing English is a lot of help in this field and in any field in work. At the same time, I think interventional oncology has some peculiarities. I mean, you need to broaden your perspectives. You need to get a lot of collaboration from all the other all the other clinicians working with this kind of patients. So indeed, over the years, having many close collaborations with oncologists, hepatologists, allow me to know, to have a wider knowledge about oncology in general. So at the end, what we are offering needs to be something that really responds to unmet needs for other clinicians. And that's the key to become a good interventional oncologist.
IR women who reach a managerial position is a rare reality. Was it difficult to get noticed in this predominantly male field?
Yes, it was. Well, you know, when I started, I was very young. It was some 20 years ago. And mainly, at least in Italy, the vast majority were men. There were very few women doing interventional radiology. And what I had to do is kind of to fight against the classical stereotypes. And to do so, I think it is very important, the behavior, the way you act in professional life. You need to demonstrate how good you are independently from your age, your gender, your looks. And at that time, I had a lot of support and a lot of help from the chief of my department, Professor Bartolozzi, that defended me against all this macho man word that at that time was present. Over the year, fortunately, had changed a lot, and I think now I have a lot of close collaborations with many interventional radiologists in Italy and abroad.
So let's move on to the opportunity for young IR trainees. The campus in interventional radiology takes place in Pisa since 2006. Over the past 3 years, the campus hosts also 10-12 European trainees. You have been part of this project since the very beginning, and you determined its development together with Dr. Vignali and Dr. Cioni. Could you explain us what it is and what are its goals?
Well, the campus was thought to let young radiologists, residents in radiologists, to let them closer to intervention, to let them understand what interventional radiology was and what could offer. It's meant to be a very informal and interactive meeting. Our faculty is quite large. Basically, we gather all the best of interventional radiology in Italy. The radiologists stay here for 3 days. We discuss cases, both live cases and registered cases. We also have a lot of fun moments, and I think it's a very nice way to get a close network between new and old interventional radiologists. I guess over the last decade, I get to meet, thanks to the campus, I think all the new generation of interventional radiologists in Italy, and right now even some European young radiologists. And it is hard work. It is very, that after 3 years we are all dead, but it's a lot of fun, and I think it's a very nice moment for new radiologists, and it's very enthusiastic moment.
Yes, it is. To conclude, I would like to ask you if you could start your career all over again, what would you do differently?
Actually, I think I'm very satisfied of what I have done so far. Undoubtedly, there are a lot of things that I don't know, and I would like to still learn and improve in my career. But that's also the beauty of interventional radiology. This is a very innovative field that is always growing very fast, and it's what makes that it's so fun. There are so many new things that we can discover and discuss and experiment, and that's why I like it so much. So I'm very satisfied with what I've done so far, and I hope I'll be able to continue doing what I've done.
We are sure. So thank you, Irene. Thank you for your answer and for sharing with us your experiences.
Thank you, and I hope all the other new interventional radiologists will join us in Pisa sooner or later. Thank you, Rosa.